WNST. We go over the river and through the woods, at least for me, to California and wherever the San Diego Chargers happen to be playing this week. It's Ravens and Chargers, and I'll be out in Owings Mills all week, and I always pass this guy's place. They are our newest sponsor. We are delighted to have LifeBridge Health Sports Medicine Institute involved with us as a partner. They're Foundry Row in Owings Mills, of course, offering the state-of-the-art facility and world-class care, including the kind that Dr. Craig Bennett's going to be giving my elbow here next week with my appointment after the holidays, as well as Dr. Kevin Crutchfield, who does all things concussion and head-related injuries. He's still kidding me about the time that I took the baseball bat when I was 6 in 1975. But he is here this week, not just to talk about football and protocol and what goes on in the little blue booth they have down on the field. But first off, happy holidays, Doc. And I know a lot of folks are skiing now. A lot of folks are ice skating. My wife is trying to get me out on the ice skating rink over at the Inner Harbor. I have promised her that I'll do that. But this is also a serious part of your practice, right? And we think about concussion, football players. Not everybody plays football, but I would say maybe 1% of the people that walk into your place are actually football players with concussions and head-related injuries. They happen in the real world, right?
Well, that's absolutely correct, and thanks for having me back on. I spent a year in Norway when I was a kid, and I learned how to do everything winter sports related, and I look at the wintertime as like a big playground, but it comes with dangers. So you look at the winter sports, and they're based on gliding and sliding, right? Ice skating, skiing, especially skiing on the East Coast where there's a lot of ice on the side of the mountain. So people fall, and they fall hard. And, if you're flying down a mountain 25, 30 miles an hour and you fall and you strike a frozen mountain, that's a significant impact. So there's all kinds of orthopedic injuries that come with that, but more importantly, there's also head and neck injuries that come with that. So, I'll start by saying if you're engaging in any winter sports, wear a helmet. Even ice skating, and people look at me like I'm crazy, but, a couple years back, Dick Button, Olympic ice skater, skating on his own, who's probably got some of the best skate control of anyone on the planet, caught an edge and fell and cracked his head and got, a bleed inside of his head. And I said to myself, if Dick Button can catch an edge and go over unpredictably, I certainly can. So when I skate, I actually wear a helmet.
I was going to ask you about that. How many people on a slope would wear a helmet? I mean, I'll be honest. I'm not a skier, and I've had opportunities to ski, and, I'm not going black diamonds and, all that stuff. I mean, but if I ever skied again, knowing what I know now, first of all, I don't know that I should ski, right? I don't know that the benefit for me figuring out how to do it, that I won't break a leg and be in with Craig at some point, let alone you on the backside after I fall and break my leg. But I would say that of all the things I think that are really, really dangerous, and not just for you or the conditions or running into ice or where the trees are, and Lord knows I know the Sonny Bono story, right? As Cher was touring here a couple of months ago, that it kind of astonishes me that more people don't wear helmets when they ski, right?
Well, if you go out west where there are really serious skiers, everyone's got a helmet. It's the East Coast beginner recreational skiers that I see still not wearing helmets, and they're the ones at the greatest fall risk. And the other issue
guys like me, in other words.
You got these kids barreling down the mountain at 1,000 miles an hour because they think they're going to live forever and they're reckless. And your more injuries come when skiers ski into each other or the snowboarders ski into the skiers. And I wear a helmet because I haven't fallen in 15 years. I wear a helmet mainly because I don't want one of those idiots running into me and giving me a brain injury. You have to be cautious of the folks around you as well. But there's other types of skiing you can engage in besides alpine or downhill skiing. There's cross-country skiing. And cross-country skiing is a tremendous exercise. And it's like jogging. You're out in the woods, and it's very serene. It's peaceful. It's quiet. It's not crowded. You got the wind blowing through the pine trees, the smell of the pine trees. It's a beautiful thing to cross-country ski, and we just don't do enough of it in this country.
Well, we got to get some more mountains and get people out onto the slopes. What about the ice skating part of this? I remember roller skating when I was a kid. A girl that I knew, I roller skated pretty well. I mean, she broke her arm first day out. Mom gets her in an ambulance for sending her out to roller skate. I would think ice skating could be also one of those things that, well, you're not thinking you're thinking I'm going to use my arm to brace myself, or somebody spooks you from behind and you fall. I would think ice skating's also one of those things that, especially for kids, that we talk about protecting kids from soccer and protecting kids from football and any other tumbling issues. I would think ice skating could also be dangerous, right?
Well, ice skating has its intrinsic dangers, but it also has tremendous benefits for athletes. So when I see, hockey players, collegiate, professional, balance is a big issue in concussion, and it's really, really hard to see balance difficulties in gymnasts and ice skaters, because when you think about it, a hockey player, they perform their sport on 1/8 inch of steel, and their balance is through the roof. So any subtleties of imbalance, I won't return a hockey player, because that's tremendously dangerous for them. But I think skating, or even recreational skating for athletes, is a great thing to do for cross-training. It really works on core balance. It really helps you shift your weight from leg to leg. If you're playing a sport where you want to use your hips to ride a player off the ball, it really helps you do that. Let's say for soccer, right? Get your legs really strong, your ankles really strong, helps you with body positioning. And it's just a great sport. But I think if you're learning and there's always a risk of falling, protecting your head on the ice skating rink is certainly a smart thing to do.
Dr. Kevin Crutchfield is a director at LifeBridge Sports Health Medicine Institute. They're out of Foundry Row in Owings Mills. You've passed them. You've seen Cal Ripken on the billboards. They join us each and every week. One week we do concussion and head-related. The next week we do orthopedics with Dr. Craig Bennett. You can find both of them and all of them at lifebridgehealth.org, and I'll also be sending the videos out and telling you more about all that they do up there, certainly for the weekend warriors. All right, so I know you got a big background in baseball. I know in addition to being a doc of all of this, and you love talking at the higher level, you love sports, you love baseball, you love the Orioles. My understanding is, and obviously the hand-eye coordination that goes into baseball and the balance that goes into baseball, you do all sorts of things over there. I don't even want to call them preventative, but I would actually call them seeking sort of an education about balance and baseball specifically. You have some techniques that you've learned and trained with over the years about how to make baseball players better, right?
Well, I actually, instead of preventive, I would call it proactive.
Proactive, okay.
Right? So I said multiple times that I think the next level of athletic performance is really fine-tuning the nervous system and how it interacts with the musculoskeletal system. So we spend a lot of effort training athletes on musculoskeletal performance, but we don't really focus on the nervous system. So if you look at football as a game of quote-unquote inches, baseball is a game of fractions of inches.
Sure.
So, and they do repetitive motion. But if that repetitive motion is not predictable to the nervous system, it's going to try and compensate for the subtle wobble, as I call in neurologic performance. So let's say you're a batter, and when you start your motion forward and you step forward, if you're slightly off with that step and you're slightly off balance, your nervous system is now focused on trying to compensate for that imbalance as you're trying to get the barrel around and level it out and find the baseball. So if that is not a consistent and predictable step, the barrel's going to be slightly off. So it may be the difference between a home run versus a foul tip. And we had experience with a professional pitcher who, unfortunately, when he went home on break, got in a bar fight and got a concussion. Ooh. And his balance was off, so his plant foot coming forward to pitch was slightly off a little bit, fractions of an inch, but that made it difficult for him to find the strike zone because his body's coming forward and his balance is slightly off. His body's trying to compensate, so his release point is just fractions of an inch off and not predictable, and he struggled to find the strike zone. But as we fix this balance with neurologic rehabilitation, there's lots we can do to fix balance and even eye movements. His ERA was coming down as we improved his balance. So you're able to predictably find the strike zone. So I think, preemptively getting a detailed neurologic exam from someone that really knows what they're doing with experience in athletics and kinesiology and starting to fix those subtle neurologic abnormalities means your nervous system doesn't have to subconsciously compensate for that. It can now focus mainly on performing the task at hand that you're asking it to do.
Now, you don't consider that a baseline thing, right? Like, I guess the first time someone comes in, if I'm a baseball player, I'm an athlete, or how about just I'm a guy that's had knee surgery that just wants to run and make sure that I'm not overcompensating or winding up with a sore left hip because I'm landing wrong. How does that work inside of your place? Because I know you do. I'm always picking at you doctors because you do so many things I don't know about. I know that if I tear my knee up, I can come in and you can help me and get me fixed. I know if I hit my head, you have science and technology. But what about this training part that I come in and say, well, doc, there's nothing wrong with me. I mean, yeah, I got hit in the head 40 years ago or whatever, but I just want to make sure that when I'm skiing, running, doing whatever the activity is, that I'm doing it in balance and I'm, quite frankly, wearing the right running shoes or the right walking shoes when I'm walking 10 miles through New York as a 50-year-old guy, and I don't want to wake up sore the next day.
Well, I mean, all those things are important. So we have this beautiful new sports medicine facility out in Owings Mills, but we are part of the LifeBridge system. And the Department of Rehabilitation Medicine at Sinai actually has a high-end gait and balance assessment device, and we can take athletes, assess their gait, assess their balance, and even assess their running technique and improve them. So let's say you have knee surgery and your balance is slightly off, we can do an assessment and we can develop rehabilitation and focused programs to fix the abnormalities that are causing that imbalance and improve your performance.
I'm signing up. I'm telling you right now. Like, I had the right knee surgery in 06. It's been 12 years. I was in my 30s. I'm now in my 50s. And, it's not just that, like, on a cold day you feel it or whatever. I really do feel like I need new running shoes, walking shoes. I do a lot of yoga, so I'm a little more balanced and flat in doing that. But even the way you sleep and the way it makes your back feel, and the way it makes your neck feel, and the way it makes your hips feel, and the way you walk, I've often wondered, like, who would be the expert to put me in a pair of shoes, which to me are probably the most important thing. If I had bad shoes, I notice it right away. But giving you the information you need to be balanced all the time. Because it's definitely the thing I felt the most after my knee surgery was the left-right. It took me years to feel equally strong on both sides.
Well, there are podiatrists who specialize in sports medicine. So they're sports medicine podiatrists, and they have devices that you stand on, and they measure all the pressure points in your foot. And they can customize an orthotic that goes into your shoes to really lessen the impact of having those issues. So, fix your balance and get the right inserts in your shoes, because every runner will tell you if you've got the wrong pair of shoes on, your knees start to hurt.
Oh, everything. Then everything starts to hurt. Dr. Kevin Crutchfield is here. He is the director of LifeBridge Health Sports Medicine Institute and all the neurology work that they do. They're out of Foundry Row in Owings Mills. Tell everybody about your facility, because I know you've been in a lot of places. You've had a lot of offices, and I know you're really proud of what you've done out there, because this is sort of a cutting edge. It may be new to Baltimore, but not new to medicine. But certainly people want to know about this for the Weekend Warriors and anybody out there that has a sports medicine-related need from y'all.
Well, it's about efficiency of care, right? So the newer facilities are looking at patient flow. From the moment you check in to getting through to getting convenient and efficient tests ordered that might be needed, getting those results in a timely manner, and integrating them into your care plan as fast as possible. So we're really focusing on trying to improve the efficiency and flow of the care and the management, which, from my perspective as a sports neurologist, starts with a very detailed history and a very detailed neurologic exam. And not everyone's going to take the time to do a detailed neurologic history and do a detailed neurologic exam, especially with an athlete. Most people that are seeing athletes are seeing them in 15-minute, 20-minute intervals. We spend a full hour. An athlete comes in with a head injury, we really burrow down into what's going on with the nervous system, what's broken. It's kind of an engineer's approach, right? What's broken, and how do we fix what's broken? And we don't just place them in an algorithm based on a list of symptoms. We actually look at how the nervous system is functioning and fix the problem based on what's wrong.
You know what? I'm going to find out what you like to do off the field, because I love talking about the doctor stuff, but I'm sure we could talk about like our favorite coffees and our favorite meals as well. Dr. Kevin Crutchfield is here. I'm always my mind's always blown when I'm talking to you, because I sort of meander into these areas where we start with concussion, but you guys do so much more than that out there, and I'm interested in coming out there and maybe what do they say, wearing the little pads and going through and being the guinea pig, as we would say in the real real world to come out and learn about this sort of stuff, because I do have questions about all of this. And I think for any athlete out there that's running a 5K or a 10K, here's something for you, Doc. And give me the best advice you can give me on this. My wife, we went to Tony Robbins last week. We did a whole week. She really wants to run a half marathon, right? So it's really important to her. I don't know why half. I don't know why it's not a 10K or a 5K, but this is her thing. And on her list for 2019 of goals, she wants to run 13.2 miles or whatever it is, right? What would you say to her for someone that's never run a 5K or a 10K to ramping up for this? If she comes to your place and says, I've had cancer, I've had leukemia, I've had a bone marrow transplant, I feel anatomically okay, I'm good to run from here to there, I can run, whatever it is, a mile without hurting, what would be the battery of things you would do for someone, 46-year-old woman like my wife?
Well, I think the first thing to do is to get a proper run analysis. Make sure her technique is proper. Because running, it's the same motion over and over again. And the most common injuries in running are overuse injuries, especially people that set a goal. So you have to really train to get to that goal, and you don't want to go too fast because then you're going to injure something. So the best place to start would be a good running analysis of running form. And then,
so you do that. Like, she could come out to your place. She's listening right now. She's outside with it. She could come out there and get on a tread, and you could. So is that video? Is that imagery? Heat imagery?
Well,
how does that work?
It's eyeballing. We have LifeBridge Health and Fitness, and we have folks with Parisi Performance. So we would get the folks from Parisi Performance to watch her run and work on technique of running. And looking at proper technique, where's your center of gravity, where are you striking on your foot, how much stress are you putting on your other joints, and fixing the form so that when she starts to increase the mileage, she's doing it properly. She's doing it with proper form. And again, probably seeing a sports podiatrist and getting fitted with proper inserts in the shoe. Making sure it's the right shoe is going to be critical as she starts to increase the mileage. So, and then working her body up slowly to get to the point of being able to do it without injury.
I'm sending her to you. I'm serious, because she's talking about it, and I'm a little worried. Come on, the husband. I'm always worried, right? I'm just sort of like, man, let's do everything we can do to make sure you don't get hurt. You spend enough time in the hospital, right? So, and she wants to do this for her health and for achievement and all the reasons people would want to go run in the Baltimore Running Festival in October. I'm going to call the Corrigan folks over there and set it all up, but this is something that's very serious for her over the next 9 months. And my first thought is, well, learn how to do it right the first way. And to your point is, if you're going to be taking 10,000, 20,000, 1 million poundings over the next 9 months, make sure every one of them is done the right way. Like, I guess if you're going to throw a baseball, make sure the first pitch is right before you throw the 100th pitch, right?
Well, Richie Bancels, former, head trainer from the Orioles, says proper throwing technique is worth everything. And the reason why people think Tommy John makes pitchers better is because finally, after they've had surgery, someone takes the time to teach them how to throw properly as they rehab. So they end up throwing better because they actually have better technique. So up front, instead of throwing the wrong way and injuring yourself, being taught how to throw properly to prevent that injury in the first place is going to make them a better pitcher. And I think, anything that's repetitive, getting proper technique down before you increase the volume of repetitions is critical in preventing injury.
You worried about the Ravens like me or no? You okay? You calm about all this?
My life is the weather is what the weather is. Good and bad is our judgment of it.
You'll let me know on Sunday how they did.
Well, it's sports. The beautiful thing about sports is the reason they play the game and keep the score is we don't really know going in who's going to win on any given Sunday. And that's the beautiful thing about sports. We can pontificate all we want the week ahead, but you know what? It's all about on the field, who's going to gain dominance on the field that day, and that's the unpredictable nature of sports.
That's why we're ordering pizza and wings here this weekend. Dr. Kevin Crutchfield is the director of the LifeBridge Health Sports Medicine Institute and the Sports Neurology Program and Center over at Foundry Row. They're in Owings Mills. They're going to be helping me and helping my wife get the 13.1, right? It's 26.2 and 13.1, whatever it is. The new game plan for sports-related injuries, you can always find them there as well as at lifebridgehealth.org. We'll be telling you more. Doc, have a great holiday. Enjoy the cookies and the coffee and go over the river and through the woods and all that stuff. And we hope to see you early in 2019. And hopefully the next time we get together, the Ravens are talking about playoff games, hopefully.
Well, we can only see what happens on Sunday, right?
Appreciate you, Doc. Happy holidays.
Yep. Have a great day.
You got it. Great conversation there with Dr. Kevin Crutchfield. Started with, skiing and skating, and then we went to baseball, and it ended with, hey, my wife wants to run a marathon. What can you do for her at LifeBridge Health Sports Medicine Institute? So there you have it. You've seen Cal Ripken up on the billboards. I'm going to be interviewing the doctors. You've heard the ads here. You've heard the live reads, as well as sponsoring of all of our reports from Owings Mills and our Ravens and Orioles inside work with Luke Jones. I am Nestor. We are WNST.net, AM 1570, and WNST, Towson, Baltimore, and we never stop talking Baltimore sports.